Mental attitude. Successfully wearing a complete denture is a learned skill for most patients and especially for new denture patients. Therefore, the mental attitude of the patient may play a very important role in the edentulous patient's ability to adapt and can be very valuable information for a dentist to help evaluate the ultimate prognosis of a denture patient. Dr. House has classified complete denture patients into four mental attitude categories. They are philosophical, exacting, indifferent, and hysterical. So first coming to House classification. In 1950, Dr. M.M. House classified patients as philosophical, exacting, indifferent, and hysterical. This is the most widely used classification. What is philosophical patient? The philosophical type is the best mental attitude for denture acceptance. And these patients are rational, sensible, calm, and composed in difficult situations. They overcome various conflicts and organizes his time and habits in an orderly manner and eliminates frustrations and learns to adjust rapidly. Coming to exacting patient. It may have all of the good attributes of this philosophical patient. However, he may require extreme care, effort, and patience on prosthodontist's part. Patient is very methodical, precise, and accurate and makes several demands. Patient is comfortable when each procedure is explained and discussed with them in detail. Coming to the indifferent patient. They present a questionable or unfavorable prognosis. These patients are identified by their lack of concern and motivation and apathetic attitudes. Pays no attention to instructions, will not cooperate, and is prone to blame the dentist for poor dental health. An educational program in dental conditions and dental treatment is the recommended treatment plan before denture construction. And moving on to the last group, they are hysterical patients. They are emotionally unstable, excitable, and excessively apprehensive and hypertensive. And the prognosis is often unfavorable and additional professional help is required prior to and during the treatment. And the patient must be made aware that his or her problem is primarily systemic and that many of his symptoms are not result of dentures. So that's all about the House classification of mental attitude, and there are various other classifications for the mental attitude of the patients. They are listed here. So by Alan Mack, he classified the patients into endomorph, ectomorph, and mesomorph. By Winkler, into hardy elderly, senile aged, satisfied old denture wearers, and geriatric patients who do not want dentures. According to IPW-CDO, there are two classifications, maladaptive response and adaptive response. Gammer et al. It is a modified House classification into 5. They are ideal, submitter, reluctant, indifferent, and resistant. And the Ettinger and Beck's frail elderly, functionally dependent elderly, and functionally independent elderly. And Blum, reasonable and unreasonable. Then the classification 2 is cooperative, apprehensive, and uncooperative. That is, the apprehensive is also classified into self-conscious, anxious, chronic complainers, frightened, and obsessive or exciting. And finally, Frankel into 4. They are definitely positive, positive, negative, and definitely negative behavior. Thanks for watching. Please do subscribe, like, and share my videos. Thank you.